is to note that the discourse around climate change are expanding, cutting across all the sectors and cutting across all the demanding fields. Those who are arguing one another, kindly settle. This conversation is just meant to facilitate you to settle down. And I think what is useful within that particular process and noting the and more importantly informing political conversations around economic divides. It is also important to begin to look at how issues of climate change manifests within the field. And Pan-African Climate Justice Alliance has been leading quite an elaborate process, ensuring that Africa as a continent has a common position on issues of climate change and health. I think we've been so far able to cover quite a significant ground in terms of ensuring that we have a position. That position is well understood by the ministers of health, climate change, and also partially treasury. We've also done quite some justice within it in terms of connecting it with WHO. Those are kind of connections that we've been able to pursue that far. But climate change, as I said, is impacting all the sector, and its impact on health has also impacts on agriculture. So you cannot treat climate change and its impact on health with isolation to its impact on agriculture. We have a panel, we have a moderator who is coming in to spearhead this conversation. So I'm not the right person to spearhead the conversation. I just wanted to be sure that you are all settled. So we have our colleague Benson, who is taking the space. Benson Simba. Simba means lion. But for this session, I know it's not going to eat you. But it's going to lead a discussion, a quick discussion, through which we are able to build some serious perspectives on the nexus between environment, climate change, health, and agriculture. It's a brief session that meant to harness scientists and ensure that in our engagement, we are able to position the discourse around health right within agriculture and also look at the implications of climate change on agriculture and the converse on health. Benson, this floor is meant for you. You've got strictly 40 minutes to prosecute your case. So, over to you.
Thank you very much, Philip, for that introduction to this session, so that we make the best use of time. Let me request the panelists for this session to come up front. We're happy to have in our presence the Director General of NIMET, Prof. Please welcome. Very glad for you. So much, Dr. Caroline from Cameroon, please, member of the Regional Technical Working Group for Climate and Health, welcome. Okay, Peter, please. The EP of CWMTOs, please come also our please. All my panelists, you know yourself, please come. We are in the meeting. Dr. Chimere, come over. You give them additional food so they manage to come. Okay, thank you.
He doesn't want me to sit there. He said he wants me at the middle there, and I don't want to.
I'm afraid we're taking that session.
Okay.
Thank you very much. So I think we'll start.
Yes.
Okay, thank you. So Philip already said that we will attempt to do a conversation around the nexus between climate change and the health, environment, and agriculture, all of that in one box, and just try to bring out a couple of issues that are related to this. I mean, as a continent, like we already said since yesterday and today, we're struggling to feed ourselves, address issues of chronic hunger and malnutrition, and we're not anywhere there. So that means that we still have a couple of things that we need to do. If anything, actually, Africa has the highest hunger burden across the world. So that tells you quite a lot for us to achieve, to think about in that box. But before I hand over, just to request my panelists to already start off. I want to say one thing, that between the year, it's according to the World Health Organization, so between the year 2001 to the year 2020, there was a total of 1,170 public health, events that were reported globally, and 56% of those represented, 53% of that represented climate-sensitive diseases across the world. So that's how huge the connection is between climate and health. And so to better paint that picture, I want to invite Dr. Caroline, who comes to us from Cameroon, to paint that picture clearly so that we sort of understand. We build that nexus from health and then move towards agriculture, as well as the methodological part of this conversation, the data part of this conversation, as well as policy as we move forward. So Caroline, please welcome to the podium to start us off. You have 5 minutes to do your presentation. Thank you so much.
I'm Dr. Caroline, medical practitioner, chairperson of Climate Change and Health Cameroon. I will try to set the stage between the nexus between climate change, environment, agriculture, and health. Climate change is a global issue that is involving everybody, everyone, and threats across all sectors, including agriculture, environment, and health. Global warming, which is a key issue about climate change, has a lot of impact on health, ranging from the molecular health up to public health. At the molecular level, global health is going to distort our cells, cause mutation, dysplasia, metaplasia, and that's why you see that we are having a lot of cancers, a lot of malignancies that we cannot explain. Looking at climate change and health, you also see that we are having a lot of diseases, vector-borne, waterborne, and even some diseases that we cannot explain. My colleague from Kenya yesterday was asking a question why there are a lot of malignancies and something there. While I went on the studio to bring up my slides, it's important to note that health, by the WHO definition, is a state of mental, physical, and psychological well-being, and not just the absence of disease. And there's an interplay between health and climate change. And we cannot talk about health here, environment, agriculture, and climate change without talking about the social determinants of health. When you look at the social determinants of health, the group of 4, the first one is food security. And here we are in a conference looking at how to adapt to agriculture, which aims preventing the food scarcity. Once there is food failure, everything fails. You cannot be healthy if you don't eat well. It's important to know that when our environment is not clean, when we litter our environment and we have things like that, when the environment is littered with waste, plastics, and we have floods because of the effects of climate change, and now we have erratic heavy rainfalls, we are going to have a lot of diseases, either waterborne, airborne, and we are also going to have mental health issues. Because such effects of climate change are going to bring about loss and damage. People lose their homes, they will be displaced, exposed to hazards that can cause mental health issues. Stress, like post-traumatic stress, you can imagine coming back home and you discover that you are homeless. It's going to be an issue, and that's why we have a lot of prevalence of mental health diseases and diseases that we cannot explain. Also, in agriculture, the effects of climate change are going to cause changes in the ecosystem and going to affect agriculture. When my colleague from Nigeria was presenting yesterday, he raised the issue about flood that cost millions of dollars, and the effect we cannot come back to it. So it's very important in this discussion that we look at in details the relationship between health, economic, the environment, and agriculture. Because without that, we cannot move forward. We need a healthy population, and to have a healthy population, we must adapt in our agricultural sectors in order to do well. I leave the floor for my panelists to contribute. Thank you.
Thank you so much, Dr. Caroline. I think I want to request another panelist to come and weigh in on how this kind of impact on the health sector and manifesting themselves with the kind of populations that we deal with. My brother Dinadu, Dr. Dinadu, who is from here in Nigeria, to weigh into this conversation. Thank you so much.
Thank you very much. My name is Samuel Chinagado, clinical psychologist and the coordinator Make Change and Health in Nigeria. Just like the previous speaker has said, climate change is a major driver and a major contributor to health crisis. It is not just a global issue, but it's more of an existential issue that threatens the life of millions of people, especially in the African region. The thing that we know is that based on the report of the Climate Change Vulnerability Index in 2014, the top 10 countries that are most vulnerable to climate change impact, 6 out of those countries are African countries and in sub-Saharan Africa. The reason why this is so is the tropical region, where you have the majority of the smallholder farmers come from the African region, and they contribute a large chunk of efforts to provide food and agricultural produce. Climate change has been reported, like I said, as a driver for emerging food risk at various stages of the food chain. Now, this makes us climate change affects health in 4 major ways. First, in the area of communicate the intensity of tropical cyclone, especially the one we had, I think last year or 2 years ago, early this year in Malawi, where you see vast destructions they constitute the majority of the poor we have over in the continent. When Dr. Fisher was the economic banker, the developmental banker was talking about distribution of poverty. That map is very fascinating, is that the distribution of poor people globally is situated along the tropical region, and basically in the African area. That tells you that the majority of the smallholder farmer constitute these individuals that we refer to as poor in their socioeconomic income. So, tropical cyclone can raise the risk of transmission and outbreak of infectious diseases, including dengue virus, malaria, cholera, Zika, diarrhea, dysentery, and acute respiratory infection. As vector breeding, while hindering sanitation management and good hygiene practices. Just like the previous speaker said, once there's no good hygiene practices, you can be sure that disease will spread faster. Tropical cyclone often cause population displacement and can inhibit healthcare access. Now, when you have flooding and when you have tropical cyclone, you can cut off supply or you can cut off reach from medical services or intervention. So the individuals who is now at risk is that person who doesn't even have any means to take care of whatever health emergencies that can worsen overall flooding rates and increase frequency of flood, just like we've seen in several African countries, sub-Saharan African countries. Flooding disrupt and contaminate freshwater supply and can contribute to poor sanitation, damage of infrastructure, and disrupt access to healthcare services, like I've said earlier on. Climate change intensity droughts, where the decreased rainfall, infectious disease can become more significant through contamination of groundwater. In other words, because of the variability of rainfall patterns, you have rainfall within an area that ordinarily should last for months. You have that amount of water pouring down within a couple of days. And you can also experience long season without any rainfall, introducing drought. And when drought is introduced, or when we are experiencing drought, the tendency for groundwater, where smallholder farmers can dig well to get water, can easily be contaminated with virus and bacteria. And because they depend on this water, you see them come down with sicknesses and diseases. Also, because their immune system is also very compromised, they become easy prey to such condition. Now, on the other hand, high temperature and humidity can combine with changing and increasing variability of precipitation can also lead to risk of vector-borne diseases and reduce effectiveness of vector-borne control intervention. In Nigeria particularly, there are periods where there are individuals who they would have malaria, you treat, the malaria is not going. In fact, we are now having increasing cases of treatment-resistant malaria. It's all because of a situation like this. The condition, the increased temperature is creating a conducive environment for malaria that are resistant to different anti-malaria that we have around to become widespread. So you see individuals having malaria that are very, very resistant. And also bear in mind that we have a very large number of under 5 mortality on account of malaria parasite. Now, on the non-communicable disease angle, we have chronic disease due to dehydration, respiratory distress, malnutrition among smallholder farmers, drowning, especially when we experience flood. Many of the smallholder farmers are exposed, and because of infrastructure, a lot of them will lose their processes that can affect the nerve system. And when that happens, there can be permanent damage for that individual, which could also compromise their means of producing whatever it is that they are producing on the farm. Sea level rise causes growing salinity, especially among people who are around the coastal region. And where smallholder farmers work, as a result, they are subject to saline-related issues such as hypertension, cardiovascular disease, and even miscarriage. Sometimes you see the increased cases of miscarriage among women who are around coastal region. You don't know that these factors, this increased salinity in water that they consume, is contributing to such issue. Now, on the mental health aspect, you can't overemphasize the impact of loss, to the mental health, the mental function, the psychological functioning of the farmer. A lot of farmers have emotional tie to their farm produce. Sometimes you see farmers go to the farm, their produce is doing very well in the farm, and you just see them doing the food, but being very happy. But a lot of the time, we have farmers who committed suicide on account of destruction of their farm produce. We have a particular tribe in Nigeria called the Fulani tribes. They are basically cattle breeders. They have a very strong tie to their cattle. In fact, if they lose one cattle, it's like they've lost a child. And you can imagine the impact of desertification that will push this. We are sitting on the time of, especially if you consider the role that the farmer, the smallholder farmer, play in food production, food security, and everything that has to do with agroecology. Thank you very much.
Thank you very much. I think for those of us in this room who have been part of the conversations of climate change for the last 30 years, you would appreciate that health has not been on the table. Health has been sidelined. And part of the conversation we're trying to just raise in this meeting is for all of us to appreciate that there is connectedness between health and all the SDGs that we work with, and that we are not going to achieve any of those SDGs. If it's SDG 17, it's talking about partnerships. It means that the health sector should be part of it as well. And several of those other, SDGs that we work with, including the Agenda 2063 for Africa. None of those agendas are going to be achieved if you have to leave out any sector at the end of the day. So thank you for trying to paint for us that picture in terms of the details around this. But even as we amplify the conversation around climate change and health and agriculture and the environment, do we have capacity within the health workers themselves to even address these kinds of issues? Sir, please.
Good afternoon, professional colleagues, comrades. The name is Pastor Taz Omorakwo. I am the executive president of Across the Borders, a pioneer NGO that was granted observer by the UNFCCC since 2004. So we have been at the forefront of the campaign of connecting health and climate change. And I will speak briefly on the recent link. Now, before COP15 in 2009, there was just a single line statement about health and climate change. And in COP15, the WHO with 27 NGOs came together and formed what is called the Friends of Health. We began a campaign in trying to promote health as a driver for the discussion of climate change. Now that has been going on, and not until COP27 in Egypt last year, did we have a serious commitment by the UNFCCC making health a thematic issue as a policy within the UNFCCC system. And in COP27, the theme was partnership for implementation. And then going to COP28 presidency which is the UAE, recognizing the importance of health in the climate change discussion, decided that health should be made the heart of any climate change action. And how can this be possible? They actually developed a document known as the Health Declaration, the 28th Health Declaration, which is to be adopted come 3rd of December. Because on that very day, for the first time in the history of the UNFCCC activities, there's going to be a day dedicated to health. Why am I giving this background? I'm giving this background to underscore the importance of health. But we're talking about health, we're not just talking about disease control, we're not talking about health promotion, but we are talking about how to have a sustainable health care delivery system. And now, the WHO, that has been the driving force behind all what we're doing, came up in COP26, came up with a program known as ATTACH, that is Alliance for Transformative Action for Climate and Health, ATTACH. And that program has 4 principles with which to work. And that principles are what I'm going to talk about. And that is 1, it says financing for commitment of climate resilient and sustainable low carbon health system. 2, climate resilient health systems. 3, low carbon sustainable health systems. And 4, green supply chains and equipment. Now, how will you achieve all this if the people who are supposed to drive this process are as ignorant as any other man? The problem is the fact that a lot of people believe climate change issues is an environmental issue, which is wrong. Now, when you're talking about green energy, you're talking about reduction of reduction of carbon emission, you're talking about phasing out of fossil fuel, you're talking about smart houses, smart roads. But the question is, why are you developing all this? It is because you want this for your health and my health. In which case, the measure by which you measure your success in any climate change activity is dependent on the impact on your health and our health. And which is why it is very important that health becomes the driving force for any climate action. If you agree with me on that discussion, then what are the roles of the health workers? How are you going to have a resilient health system? If the health workers, when I say the health workers, healthcare professionals, because the healthcare system is a multidisciplinary system, where from the gate man at the hospital gate up onto the nurse in the ward to the consultant, all of them work together to provide a comprehensive healthcare delivery to the patients. Now, when there are climate change disasters, who do you run to? You run to the hospitals. Who are those that can provide the service to save life? It's the nurses, the doctors, every healthcare worker. Now, when there are disasters, what do you try to save? Do you try to save properties that are falling? No. The focus is on the number of lives to be saved, which is why across the borders with WHO and other partners, we've been at the forefront on the need to ensure that the healthcare professional, the healthcare system, the workers in that system, their capacity are built. Now, if you look at all the decisions that we've taken, it's quite that health is highly mentioned. A lot of funds is being provided for activities, but no fund is allocated. So we are working with the various ministries that are concerned to see that yes, the Ministry of Health is involved. It will be true that the Ministry of Health, most African countries, are not even involved in the administration. They are not even involved in the development of the national adaptation plans. They are done for them by the Ministry of Environment, which is wrong. Now, COP15 focus is that every country should come to COP28 to give their report on the national government commitment, where they are also found as far as adoption is concerned. And it will show that yes, the ministries of health have not done much. So that is why we are calling on all the major partners that yes, the time has come to recognize health as the fulcrum of all that has to do with climate change. And finally, I was shocked when they said they developed a document known as the Climate Change Act in Nigeria. Go and look at that act, look at Article 5 of that act, and they give you the membership of the National Climate Change Council. The Ministry of Health is conspicuously absent. So how can that be? And so there is a lot we need to do. We call on the support of every one of us to ensure that yes, without health, the health of every nation is the wealth of that nation. And so I call on every one of us to join hands with what we are doing, and we will be to 28. And to God be the glory, we also say that campaign. Thank you very much.
Thank you so much. Thank you for giving part of that history and also part of the future. I guess, as you rightly said, if we compartmentalize this work that we do around climate change, then we don't achieve the results that we could achieve at the end of the day. Now, in Nairobi, during the African Climate Summit, we had 2 ministerial meetings that were looking at this same conversation of climate and health. And in the 2 sessions, okay, we had one means what? What is that saying? Which means prof. Thank you. So it came out in that meeting that out of the 4 ministers in the panel, the health ministers, none of them was part of the climate councils, national climate councils. So the ministers don't sit there, but they're supposed to be part of the HNAPs, for example. And so how do the national systems look like? Maybe we'll come back to that as we continue this conversation. But Prof, maybe Prof, who is the Director General of the Nigerian Meteorological Agency, is here with us. And the role of evidence is very important and very powerful in the nexus between health, environment, and agriculture. And if we don't have evidence, we cannot negotiate very well at home, and you know that. If you don't have the evidence, you cannot do the innovations that you need to do. If you don't have evidence, you cannot do the correlations you need to do to understand the cause and effect and the solutions. So I want to request Prof to come up front and speak about what kind of evidence is the agency, for example, in Nigeria, collecting in terms of the data that they are looking at. How can that data be a solution to the innovations we are looking at in the health sector to address climate-sensitive diseases? Are there opportunities to address the problems around food?
It's the oldest government FDA in Nigeria. We are about 140 years old since before Nigeria became independent. About 2,000 scientists spread across of the country, and we do our service based on the available source of data of weather, climate, and detail on more than 70 parameters. With this, we do 3 layers of service. One, we provide popular weather service based on products, services, and from that data. And this is short range, medium range, and long range weather forecasts and predictions that gives 4 months to less than a day lead time for stakeholders to take into consideration integrating weather and climate into their activities. The second layer of activity is we provide support service to different MDAs. Agriculture, we're very passionate about it because in Nigeria we belong to the tropics and 80% of our agriculture is rain-fed. And rainfall in the tropics is highly variable. Rain heavily here, the next district there will be no rain. And with this you need a very fine precise weather focus to be able to plan climate activities. For health, we belong to the tropics and most of the tropical diseases that my brother they are climate-induced, meningitis, cholera, measles, malaria. For meningitis, Nigeria accounts for more than 80% of the recorded cases on the belt, so we're very also passionate about this. And last but not the least, the category of our service is the tailored service based on the praise of different users. So for us in Nigeria, we don't want to rely on imported literature regarding climate change. That is why we use the available historical data to be able to generate and also provide evidence that there is local indicators of climate change. participated in different projects internationally and realized most developing countries suffer from what is called maladaptation. And this is as a result of taking global and regional scenarios of climate change and adopting it to your country. And as a result, also develop and adopt also adaptation and mitigation actions into your country. So this also do more damage than even the climate change itself. So that, for us in Nigeria, we now use long-term historical data to generate and also provide evidence of local indicators of climate change. And one of it is changing rainfall pattern. Over the last years, the rainfall pattern has greatly changed in terms of onset, cessation, total rainfall amount, and also end of the growing season. So the season is shortening in terms of the lifespan. Focus especially for medication storage, because it affects also the efficacy of medicines also. We do also provide for the especially agricultural community flood and drought prospects on monthly basis. For agriculture, we're very passionate because on 10-day basis, 30-day basis, or decade, we provide forecasts and advisories to our farmers. Because we realize simple information of onset dates, cessation date, length of season, total rainfall amount, and the end of season could make the farmer to lose more than 80% of the yield for the year. Because if you plant earlier than the onset date, and the onset date is not the first rain, is when you have accumulated moisture of about 50 to 60% in the soil. And so we have a model that we are the first country in Africa that is running independent forecast for our citizens. And we're very passionate for farmers. And through our downscaling activities in IFAD project and NGOs, we realize farmers request additional information of crop calendar. And this crop calendar provides day-to-day activities from land clearing to harvesting for farmers, and it can even give a yield forecast. So based on that, we conducted research and realized uptake of this information will guarantee 35% increase in yield and also 95% increase in the use of extreme weather climate. So based on this, we developed an app. You can download it on real-time climate weather app, and it has different sectors. Section 8 where you have information from 774 local government areas. State of the climate, we've been doing this for 15 years, and it is through this document that we are able to detect and identify local evidence of climate change. And it's also available on our website. And based on this, we advise different relevant government MPAs that the climate is no more business as usual. And as a result of this, we need to do more of adaptation and mitigation actions. One indicator of climate change is increase in extreme events, and we documented this also in Nigeria. On a quarterly basis, there's one city in northeastern parts of Nigeria that experienced 35% of their total rainfall amount in a single day. Over 200 millimeters of rain in less than 5 hours. And that's about 30-35% of their total rainfall amount. So with increasing range of extreme events, temperature rise both day and night time, and also multiplied application of health, agriculture. So we need to document this, and we doing this on a quarterly basis and advising the relevant also is last but not least. This is the one-stop document that for population climate change adaptation, mitigation in Nigeria, and it covers across all the eco-climatic zones of the country, and it provides evidential training of the climate change and also with localized adaptive and mitigative measures. So, in summary, I can say as an African that climate change issue is the issue of social justice. We contribute less, we suffer most, we are worse because of our adaptive capacity. And I remember also the saying by Hansel that we have 3 options regarding climate change. And the 3 options adaptation, mitigation, and software.
I would appreciate the DT better than you are. Thank you so much. You know the government will stop you and you don't stop the government from because they are congesting this government. I'm saying that silently, but thank you so much. So let me draw your attention. I mean, a lot of things have come up from this presentation. I also wanted to draw your attention to the processes that are currently happening, which partly Peter tries to speak to. So in 2008, there was a declaration on environment, failure, and health. And since then, a lot of processes have been happening. 3 months ago, the Pan-African Climate Justice Alliance, working together with the World Health Organization, the Afro Office and Geneva, and several partners from Africa, and almost 30 governments, representatives from different 30 governments, were able to convene in Inauguration, Malawi, and they came up with the first ever African Common Position on climate and health, which is part of the road to open aid. So I want to invite Dr. Chibere to speak to us what is that Common African Position on climate and health, and at the end of it all, also reflect on what is in that African Common Position in terms of the connection between health, the environment, and nutrition and other sectors. So thank you so much. So Dr. Chibere, you're welcome.
Good afternoon, everyone. Good afternoon, everyone. I think you're hungry now. Oh, you want to sleep? Which one? Alright, so my name is Chinari, as you know. I'm a background in public health. I'm also environmental toxicology. And so in August, that was what we were allowed to discuss the impact of climate change on health. And you see that because it can be a cross-cutting issue that transcends agriculture, environment, health, climate change, even things we don't talk about, including soil. Yesterday we was talking about the health of our soil and how we don't take note of the fact that the chemicals in the soil can get into your food and then affect you. And then 10 years, 20 years down the line, you have disease like spring. So I also made a mention of chemicals that are banned in developed countries and now the one using. Example is DDT. We may not know because it's not in my backyard. You don't even know because it's not big enough. It's not as big as COVID-19, right? But COVID-19 is a mental health issue. So how you get to know that climate change is also affecting these things? And within the last 3 years, we've had 3 global issues: COVID-19 and monkeypox. And even before then, we had other issues. So sometimes, because these things don't look like they are obviously connected, we lose sight of them. And so these are some of the things that we have discussed in Malawi. One of my friends is sleeping over there. I'm going to wake him up. Don't sleep, I'll ask you questions, so please don't sleep. Alright. And so when we have the meeting in Malawi, and we came up with some of the things. And to make it interesting, this is not even the first time. The first time this was discussed was in 2008. That was in the Brazil Declaration. That was the first time it was even discussed, trying to connect, and those African leaders trying to connect health to the environment. And they had our 11 points, and these are the things we need to do to make sure that we connected it. But after that meeting, nothing much was done. Now we are bringing it up at COP because most of the time at COP is when it comes to health, it's not really linked properly, so we don't know. And so we are taking this leadership to say, what is our position? Even as we are discussing COP28, what is our position? What are the things as a continent, what are the things we want? What are the things, how do we position ourselves so that our health don't get caught up in this whole issue? And so some of the things that we have 5 major issues that were raised. And we're saying, okay, we need to look at how we improve access to preventive health. So you don't need to get sick before you now start looking for a solution. So how can we even prevent it? So that's that's where you can see the nutrition is coming in, the agriculture is coming. Just talk about the soil, the health of the soil, the type of the food. We can be producing a lot of food that we don't have enough nutrition. So how do you make sure that the food you are eating has enough nutrition? I mean, micronutrients. Those things that can cause problems that you never thought about, e.g. IQ level, some neuro issues, having miscarriages, the child not being intelligent in school, supposed to be intelligent enough. There are small things that that you lose sight of because it's not big enough for you to connect it. So if we are not already thinking about prevention, how do we prevent it? How do we make sure that we have access to preventive health? One of the other things we looked at, number 2, was having a holistic approach to this climate health issue. So holistic means you're looking at one health approach where you're looking at the health of humans, health of environment, health of animals. So your ecosystem generally. So it's not just, oh, our environment is looking nice, but you don't care about the animals. Because you end up putting the animal for protein, as source of food, as source of nutrition. So if you think, oh, I only care about trees, but you don't care about animals, so what happens? Because you end up coming back to that. So you see how we connect all of these things that you don't look at. So when we make policies or make regulations or make any of our plans, let it be a holistic approach. Even the animals in the sea are thought about in our policies. And so that way, we are making sure that you are already having, so one of the things we discussed yesterday, which was very touching, I really like the presentation of the Development Background. So we are looking at it this way, but can we, first of all, whatever it is, we must be the first beneficiaries. This approach that we're going for a meeting or discussing it at all, Africa first. That's how we look at it. Another thing we looked at was that we have that just transition as we are moving, as we are transitioning, how are we building a health system to be resilient? So in case there's flooding, in case there's an issue, how strong is our health system to take care of some of these issues? How are we building our infrastructures to make sure that, oh, not that suddenly there is no light and therefore there is no surgery and therefore, just one little disconnection somewhere, we have 1 million deaths that we prevent. We can hope that we can actually integrate health into some of those things. Whether it's waste management is part of it, for example. How do we connect it to health and make it obvious? Water it is, but how do we connect it to health and make it obvious? And so the same, we also had that advanced along for a position for climate finance for some of these things that we wanted. So we had to make funding for it. So it doesn't end up becoming a talk show. We also looked at the as a block, we needed to establish, we are asking the AU to establish a Pan-African research organization and manage organizations under these processes to make funds available for research in relation to this. Like the environment DigiCell. So we have this data that is showing us all this. So if we didn't take that data, if we didn't have it, we didn't do a research to really connect it, you might not have evidence to ask for, even if you're asking for funding for what? So you don't have to get to come and sound like you're begging. No. There's evidence for what we need it for. So it's not like we just want to throw money. It's important. Right? So we designed a capacity building program. That's what one of the things we're asking AU to do, design a capacity building program for the African health climate community, the instructors, the professionals, the government people that are involved. We designed a capacity building program to make sure we build their capacities in that. We also advocate that they should foster research collaboration among neighboring countries. So not just, so you find that sometimes happening in Nigeria, also happening in Chad, happening in Ghana. So there should be some collaboration that you can see those differences happening something because somehow we are kind of having the same kind of magnetic environment. So for the regional economic commissions that will mobilize update of health-related considerations by member states and to support the intergovernmental authorities on developing climate prediction and applications. So some of these climate data, they already have the predictions, have to have a way to apply them. So it doesn't end up becoming one of those papers that are on shelf. There's about 7 of them then for the national government, one of the things that we really discussed also was sometimes we are signatory to some of these things, but we are applying it becomes an issue. So what do we want our government to do? As we are going to what do we want our ministers to talk? What do we want our heads of state to go and talk? So as a matter of priority falls on the heads of state and African ministries to be responsible for climate change. In all build-up convening towards this approach, how to mainstream climate challenge in health issues. So when they are talking, when they are presenting there's an opportunity for them to talk, whatever their stand is or position is during talk, they have to mention it in their talk. So that's one of the things. So whether you're working in ministry or working in with government, you have them to think through in their speech and mention that it's being mentioned. So being mentioned is also giving it a political will. So you have to ensure that full participation of ministries of health. So like one of the speakers said, when our Ministry of Health were not involved in the negotiations, so we have to make sure that our Ministry of Health and different countries are involved in the negotiations, they are involved in setting the NDC, they are involved in trying to connect, even the NDC they already have. For example, we have 7 in Nigeria, you have to connect it, obviously connect it. So we have to mainstream the health and climate considerations in our NDCs. We have to invest in capacity building. This for the nationals now. We have to foster collaboration, just like I mentioned for the African region, the states, the nations, the countries are also doing the same thing. We have to provide greater access to healthcare services, especially for the people that can't afford it. You have to look for how to just transition. So the instances where you see maybe there's flooding or suddenly there is no light, like Nigeria is depending on fossil fuel, for example, to power hospitals. But is there a way we can still, instead of thinking about powering our hospitals with solar energy, just in case there is no light, you can still run the health system without light because you already have a plan for renewable energy. So we also recommended the collaboration between ministries, different ministries, just like the same thing we did for the African region. So we have this collaboration between Ministry of Environment and Agriculture. You don't start guessing. Such random. Okay, I'm going to round up now. Okay, so I'm going to round up. You ask me questions and I'll answer you. I know some people are sleeping, I don't just want to be a very good girl. I thought I just want to be that sleeping. Just finish eating lunch, now come and be sleeping in my session. Thank you.
Thank you very much. And some of you are asking me, I've seen a text, where can we get this common African position? If you go to the Culture website, you click on, I think, publications, you will find the common position there. You can actually just download and you can read more around what the countries are doing and how you can participate. And like she said, we're currently now putting our inputs together for the COP28 presidency declaration. So if we are interested, part of this conversation, please let us know so that we can work with in terms of putting together that feedback to the COP28 presidency. So this is our submission. At this point, I want to see whether there are any reactions or quick questions as we come to the end of this session. Those hands are too many, I'm not sure where to start from. Okay, so I'll start from Mr. Chimako here. And so let me see. So let me choose gender. Okay, so there's our youth, then there is Robert here, there is Natalie here. Now let me go behind, let me see, so youth are already taken care of. Okay, then you, no. Okay, I can give you one because yes, it's a farmer. And the last one, someone who's behind there, yes, you. So okay, so in that order. So thank you very much.
Thank you very much, Steph. You know, this is a very important subject. Very, very good. And my sister, you done well. Soil. I
and communicable diseases. Where we come from, they say, when an old man like me misses the age, and you find the gray hairs in the tropics of a hyena, what has happened? He has been eaten. Don't go looking in the mouth of them. Exactly the point. You know, when we were growing, discussing here, we were taught to clean our nails, cut our hair, communicable diseases. That's what we grew up. All of a sudden, they tell you not communicable diseases. Where does this come from? When they will tell you lifestyle, those ways. You go running around to the gym. It's not the gym. It's industrial for those things that we were told, those types of empty, sick, diseased, Monsanto, glyphosate. That is what is killing. But they won't tell you that. Then you put it in the soil in Southern Africa, in Zambia, in Bukesi. The mountains are mountains of fossil fuels. They are selling to our small water farms. They're pouring it in the ground. They're killing the soils. Systemically, these things, that's what we are eating. You find the child is 8 years old. The backside is just spoiled because of GMOs. This is where the problem is now. The point I'm making is, why are we not pointing out that the food we are eating, industrial food, those guns they was talking about, is the problem? Because when we grow food, organically, agroecologically, all the micronutrients, the nutrition that goes there, even the intelligence was high. But today, because of industrial food, fossil chemical food that has gone, is what is killing us. In Zambia, there's an exponential growth in cancer hospital. They are now putting up another cancers, instead of finding out what is causing the cancer. So what I would like is, please, even this world health, there's also complexity in these things. Let's do our own research and find out what is killing us. Not waiting for these guys. We'll finish. So what I'm saying is that one of the major problems is the food we have eaten. And obviously, as you know, when your immunity has been weakened and climate change brings its own diseases, you are quickly wiped out. So that is the correction I would like us to also look at.
Thank you.
Thank you very much. I just share quick practical things which is disease related or a condition related or a nutritional disease related to climate change, which was not with us before. Even yesterday, I think a young lady from Kenya, she mentioned about the death. And where that is happening is just 10 kilometers from my house or my village. Okay, the point is, 2020 up to 2023, we lost over 100 camels in our vicinity. And normally camel cells are disease resistant. But when we check, and it's all say it's a nutritional disease related. But even me, I did not click that it's being brought by the climate change. But now that I'm relating it. But when they say it's a disease, it's even right now happening. We are given plenty of pasture and water, but it is happening even right now. So those are the researchers in this, the representatives. There's a big opportunity to pick up from their attention.
Thank you. Please make them quick and short so that we can have all the people that are allowed to speak to be able to speak.
All right. Thank you so much. My question goes to Professor. I applaud your insights and very informative presentation. And I specifically applaud the fact that you mentioned that you're working with 120 universities involved in your research and what you're implementing. So my question is, 120 universities was a bit low, considering the amount of young people that need to be involved in these initiatives. And considering that approximately 71% of African countries face a shortage of skilled healthcare workers, which is even more exacerbated in rural areas, how can we make sure that African youth are engaged in more climate-resilient agricultural practices, of course incorporating the health aspects? So we have so many organizations here, so many farmers. What innovative strategies from your research and knowledge can be incorporated so young people are more interested in taking it up? Thank you.
Okay, thank you.